Welcome and thank you for joining us today. I'm Bob Continetti, Senior Associate Vice Chancellor for Academic Affairs, and I'll be your moderator again for today's Faculty Town Hall. The winter quarter has just begun, and once again, we have brought together a group of panelists to provide updates on the continuing evolution of our operations during the COVID-19 pandemic and to answer your questions. The pandemic continues to provide new and unexpected challenges for us, so this is a timely town hall. Some questions were submitted during registration. However, please feel free to use the Q&A window to submit additional questions for our panelists. Due to our time limitations, we will not be able to get to all of your questions, but we will log the questions as they come in and post answers on the Return to Learn website with a link pasted into the chat. Today's webinar has live closed captioning available in two ways. First, you can click on the closed caption button at the bottom of the screen and select Show Subtitles, or you can also click on the link that is pasted into the chat. Now, with no further ado, I'd like to introduce Chancellor Pradeep Kosla for some welcoming remarks. Chancellor Kosla.
Thank you, Bob. Good afternoon and welcome everybody. Welcome to the first Faculty Town Hall of the year 2022. And I want to be optimistic and also wish you all a very happy and a joyous new year. Let me also thank each and every one of you for all of your hard work and the flexibility that you have demonstrated in response to the changes in the medium and the way we are delivering our instruction in the winter quarter. As you all know, reading the newspapers and Instagram and Twitter, the Omicron virus is spreading extremely fast. It's like wildfire. And the number of cases are growing like literally exponentially every 2 days or so. And this growth in the number of positive tested cases has put a significant amount of stress on our staff members, on our faculty, and on the students. And there are multiple social agencies impacted with this because of this. Our hospitals, for example, are highly impacted because many of our workers are calling in sick because they're infected. Our schools are impacted, as in K through 12, because many of the teachers are calling in sick, and our campuses are impacted too. So you can see the impact is felt by the whole community and not just by UC San Diego. And we are experiencing the same impacts as the community is experiencing. If you've been going out to restaurants, I'm sure you're not surprised when you go to your restaurant and you see it suddenly closed. It's not the government that closed it, it's the owners that closed it because the workers have called in sick. Okay, so now to deal with this, what we did initially was we said, the first 2 weeks would be remote, but the more we looked at the data, the more we modeled the data, and especially Dr. Natasha Martin and Chip Schooley, from who you will hear today, we predicted that the virus is going to peak around, the infections are going to peak around the middle of January. And by the end of January, we would still be dealing with the virus, but we would be in better shape to deal with the number of infections, especially on campus and the quarantine housing. So that is the reason why we extended remote learning by 2 more weeks. I know this has caused a lot of angst both ways. There are a lot of students and parents who are upset about this, and they're sending me mail as to why are you doing this? And I know at the same time that we have faculty and staff who are dealing with situation that this is really a welcome thing for them, for us to have done this. So there are both two sides to this equation out here, but nonetheless, we are trying to do the best we can. And I want to say, I really appreciate your support, your cooperation, and your commitment to our students and to our campus. So thank you very much. And I'm going to send this back to Dr. Continetti.
Thank you, Chancellor Kosla. I would now like to introduce our first presenters today, Professor of Medicine, Dr. Chip Schooley, Professor of Medicine, Dr. Natasha Martin, and Interim Executive Director of Student Health and Wellbeing, Dr. Angela Sosha, to give us an update on the continuing evolution of the pandemic.
Thanks very much, Bob. Dr. Martin and I are going to pick up on some of the comments that you just heard from Chancellor Kosla to try to put into perspective some of the things we've been dealing with. If we'd had this town hall at the beginning of December, around the beginning of January, what we'd be seeing are epidemic curves that look like this. things looking pretty good in the US as we came down from the Delta wave, not down to zero as South Africa was, but also at that time, not having what South Africa was just noticing a little blip in new cases starting from almost zero cases in the country. They very astutely picked up something was going on. Next slide. And found that this blip was not caused by the Delta variant, which had been circulating before, but by a new variant, the Omicron variant. And I'll just summarize a few things about it that most of you have heard from other places. It was first detected on the 23rd of November, and within 4 days, it was declared a variant of concern based on its rapidity of spread throughout South Africa, beginning around Gauteng province. It spread globally at astounding speed, as I'll show you in a minute. By the end of November, like November 27th or so, Rob Knight's group and Smriti Karthikeyan had already detected this variant in Point Loma wastewater, to give you an idea about how rapidly this virus made it across the Atlantic. The biological properties of this virus are important because they define some of the things that have made it behave differently clinically. The most important thing about it is that its spike protein has multiple mutations that cause its shape to be less avidly bound by antibodies that are generated by the vaccines that we've been using, because those vaccines were calibrated to the original Wuhan strain of the virus that is very much like Alpha, Delta, and the other variants we've seen before. This new Omicron variant has a spike protein that has multiple mutations, and it is less susceptible to neutralization by antibodies from people who've had prior strains or been vaccinated with vaccines modeled on prior strains. Also importantly, it has some mutations in its regulatory proteins that make it extremely effective in shutting down the innate immune response, the interferon response. This is one of the tricks the coronaviruses have had for a long time, but this one is particularly good at it. And what this does is allows the virus to evade the first line of defense, the innate immune response, grow to very high titers while people are without symptoms, because the symptoms we often see with flu are interferons. So you're a virus factory in shedding it to other people without being aware that you're sick. And it also seems to grow better in the upper airway and less efficiently in the lungs, which is why we see it. One of the other reasons we see it is being more transmissible and less likely to cause pneumonia, severe morbidity and mortality, as in the prior variants. Next. Now, what happened then is that it spread rapidly in the United States, and we're on a rocket curve and with 600 or so thousand cases a day over the last week or so around the US, with waves starting in the Northeast and moving toward the Southwest. Next. In contrast, what's happened in South Africa is a rapid peak and then a rapid decline. You can see that the number of cases are now between 30 and 40% of what they were at the peak. And this has also begun to be seen in the UK, where the virus went after being in South Africa. So what we've been seeing with this variant is a wave that doesn't last as long as prior strains, perhaps because it goes through and infects the entire population that it can get to quite quickly, and then things come down very quickly as well. Next. Okay, so what about data related to its ability to cause illness? These are data from the UK, and if you look at the top table, these are data about how likely you are, if you have Omicron compared to Delta, to need to be seen in the emergency room or admitted to the hospital. And you can see it's about people who get Omicron have about a 50% likelihood compared to those of Delta who get infected with Delta to end up in the ER or be admitted. And if you do show up in the ER, you have about a third as big a chance of getting admitted to the hospital with Omicron as with Delta. So this is in general, a less severe disease. In the bottom panel speaks to the efficacy of our current vaccines against the Omicron variant. A lot has been said, oh, the vaccines don't work, the vaccines don't work. Well, they actually do work from the standpoint of what matters most, which is preventing severe disease. If you look at people who were vaccinated or not vaccinated with the Omicron variant, they have an 80% reduction in the likelihood of being hospitalized if they've either had 2 or 3 doses of vaccine. If they've been dosed and boosted, they have an 88% lower chance of being hospitalized if they get the Omicron variant compared to those who aren't vaccinated. These vaccines don't do as well against preventing infection per se. That's why we're seeing all these breakthrough infections on campus. For the most part, they aren't severe in the vaccinated population, but they can be severe in the unvaccinated population. But this has been true for other variants as well. The vaccines work best against preventing disease and less well against preventing infection. Next. Now, what's happened in San Diego? These are data that were generated by Smriti Karthikeyan and Rob Knight's group and a whole host of others who have made this possible. Wastewater is harvested at Point Loma 3 days a week, and the amount of viral RNA is measured, and it is also characterized as to the fractions of different variants that are found in terms of a distribution in that RNA, in that wastewater. And you can see that it began to show up in late November and then very quickly took off about December 1st. And so by the 21st of December, about 80% of what was of RNA in Point Loma was Omicron, and that's continued to rise. There still is Delta around, and that's an important thing to know because people who get Delta still get quite ill, particularly if they haven't been vaccinated. So we have a mainly but not exclusively Omicron epidemic currently. Next. In terms of what's going on in San Diego County, it looks just like the US. You can see that 8,000 cases on the 4th. You can see that the number of hospitalizations has risen. Most of these are unvaccinated people. Many of them are still Delta patients. But the impact on the hospitals is twofold: new patients and fewer people to take care of them, with large numbers of people ill across the hospital systems. Next slide. Here at UC San Diego, with our student population, we've been having large number of students who have been affected, as many as 420 on a given day. We had a better day today, 280, which is hard to imagine saying, gee, that's a good day, but it at least is lower than yesterday. We've had a large number of employees who've been infected, 130 or so, a few a day the last couple of days, fewer today. So it's really affecting both our student population and our workers. The Student Health Service has done a tremendous job at dealing with this large number of cases in terms of getting them into safe places, but it really is stressing the system. Next. In San Diego County, you can see the percent positivity rates at testing sites are as high as 20%. It's hard to know what to do with this because people are standing in line for 4 hours to get tested, and people who may not feel particularly ill, they just say, I give up, I'm going home. So we don't really know how to put this into context about what this really means, but taken all together, there is a ton of Omicron in the county. Next. At this point, I'm going to turn this over to my colleague, Dr. Martin, who will take it from here to look into the future.
Thanks, Dr. Scully. So that's where we are now. Where might we be going in the future? One of the things that we're looking at very closely is the wastewater signal. These are data from Rob Knight and Smriti Karthikeyan and others on campus. And the blue dots and line are showing you the viral copies in the wastewater, and the orange showing you the reported cases. If you look at the middle part of the slide in July, you can see that we had a very early indication in the wastewater of the surge that would be coming in August and September. And we have had the same thing happen more recently with the early advance warning of the surge in the wastewater at the county level before the cases started rising. So we're looking at that, the wastewater data, to see whether we're likely have turned the peak. Unfortunately, the latest collection from a few days ago from Point Loma recorded the highest viral load yet. That's that blue dot on the very top right-hand corner of the slide, just under 35 million copies per liter. So we're definitely still on the way up at the moment and in the next few days. Next slide, please. This is some modeling that our team has put together, looking at some projections in terms of what this might mean in terms of hospitalizations on the left and diagnoses on the right-hand side. And there is uncertainty in what will happen with hospitalizations, especially in terms of length of stay, which are the different lines there. But generally speaking, what you can see is the modeling predicting the hospitalizations will peak in mid to late January, with cases peaking sometime potentially in the next week or so. So hopefully a swift up and then a swift decline after that. Next slide, please. And finally, we're extrapolating from that county projection modeling to try to project what might happen on campus here. These are projections in terms of the student cases that we might anticipate over January. The left-hand figure is showing what we anticipated with the January 16 return and commencement of class in-person instruction. The right-hand side showing a delayed commencement of in-person instruction to January 30th. The important thing to focus on here, I think, are those black lines, which show you the cases that we anticipate that would occur due to the student returns. And so you can see on the left-hand side, a big spike in the middle of that slide, just after the expected peak among the other students, with a student return of January 16th because of the anticipated high prevalence among the students returning in that period. Whereas on the right-hand side, if the return is delayed into the end of January, you can see that those students returning would be associated with far fewer infections because we'd be further past that peak and further along that downslope. So just a 2-week delay, resulting in far fewer incoming students who are infected. And the red bars that you can see at the top are the associated transmissions we anticipate because of those student returns. You can see larger on the left-hand side than on the right-hand side. So really reducing the number of infections as well as associated transmissions quite markedly just by delaying the return 2 weeks. And we're also doing this modeling to anticipate what this all might mean in terms of isolation and quarantine housing. And so we have adjusted the numbers and we to ensure that we have plenty of housing available and in the coming month for the students that are here or arriving. And now I'd like to turn it over to Dr. Angela Sosha, who will talk about boosting and vaccination.
Good afternoon. So, how we respond to the current situation. So just remind everybody about booster eligibility. You heard from Dr. Schooley how important being boosted is in reducing your complications from these infections. So Pfizer and Moderna, the common ones we gave, if you've completed your series 6 months ago, you are now eligible. And if you've not received your booster, you're not considered fully vaccinated anymore. So 2 months after Moderna and Pfizer. If you had Johnson & Johnson or some of our international colleagues had AstraZeneca, it's 2 months after vaccination for your booster. And many of our international students have had some of the killed virus vaccines. We want them to boost now and also consider getting a second messenger RNA boost because of the ineffectiveness of these other vaccines. If you're immunocompromised, speak with your provider. Next slide. This has changed some of our language, and it's important that we all get comfortable with what is now considered fully vaccinated or not fully vaccinated. Fully vaccinated now, if you are booster eligible, you need to get that booster and a 7-day period to have the effect of that booster, and then you are now back to fully vaccinated. So if you've received your initial dose and you're not eligible for a booster, you're still fully vaccinated. But if you crossed over that eligibility period, you're now in the not fully vaccinated community. So if it's been 7 days since your booster, or you haven't had a booster and you're eligible, or you didn't complete your initial series of a 2-dose series, or you've had no vaccine, you're considered unvaccinated or not fully vaccinated. This has some implications for our testing program. Next slide. So how are we doing the testing in this quarter? A little different than fall. So if you're unvaccinated, or if you're vaccinated eligible but not having had your booster, or it's less than 7 days, we want you to test twice a week if you're on campus. If you're boosted or fully vaccinated and not eligible for your booster, weekly testing is encouraged but not required. Everyone, regardless of your vaccination status, should test if you develop COVID-19 symptoms. That is really important. So do not assume you've got protection because you're boosted. We need to know if you are shedding virus for your own health as well as those around you. Also test if you're in a building that has wastewater. If you're living or working in that building, take advantage of the wastewater signaling on the RTL site. However, if you've had COVID-19 in the past 90 days, you should not test, and you're exempt from testing requirements. This is really important because you will just have, again, frequent shedding, but not infectious shedding. You'll get a test. The teams will start calling you instead of diverting attention to the people who need new diagnosis with new infections. So please, no testing if you already have had a diagnosis in the last 90 days. A new infection is extremely uncommon. If you should develop some new symptoms and you're concerned, speak with a provider. And if they recommend testing, then we do it. But do not test otherwise, and you do not need to test based on the requirements we described above. Next slide. So how does this fit into our mandate? The mandate language considers full vaccination. And so a booster is required for full vaccination now. If you are eligible, the deadline for compliance is January 31st. For healthcare workers, after you become eligible, you have 15 days to become boosted. If you're a campus employee or a student, it's 30 days. If you have an exemption that's been approved for vaccination under the mandate, it covers your booster. So you remain exempt. Next slide. Isolation requirements. There have been some changes here. There was a blip for the CDC on the last Friday, and that changed on Sunday when CDPH, California Department of Public Health, announced their requirements for isolation, and they're a little bit different than CDC. In California, it is a 10-day period of isolation unless you are without a fever, your symptoms are gone or resolving, and you have a negative rapid antigen preferred after day 5, and you continue to mask around others for the complete 10-day period. So it's not enough not to have a fever and have no symptoms at day 5. You need evidence of a negative test. A rapid antigen test is the preferred method. Next slide. Quarantine has changed a little bit too. If you're exposed and you're a boosted person, fully vaccinated, meaning you're not eligible for a booster, you are tested notification day 5, but you're allowed to continue to move about. You need to mask around others, which means you work if you're coming to campus or you're going into the lab. But again, you must mask, and we encourage you to test on notification in day 5. If you're unvaccinated or you've been vaccinated and eligible but not boosted, you need to stay home for 10 days, mask around others in your household, test again on notification in day 5. If the day test 5 is negative and no symptoms, you may end quarantine, but you still must mask for another 10 days. So a little change here. Next slide. How have we managed this for the students? Well, you heard, we're encouraging the undergraduates who went home for break to delay their return until later this month. Housing and Dining is providing a financial credit for those delayed returns. We're also taking advantage of self-administered rapid antigen tests, mailing these out to the students and asking them to test 24 to 40 hours before returning. If it's positive, they notify student health and HDH, and they isolate in place so they can complete their isolation before coming to campus. In addition, all of the students that are arriving are completing a PCR test, and that is regardless of their vaccination status, because we know that with the rapidity of this viral spread, you can have a negative test a couple days ago and become positive. And so we are doing an extra safety step of making sure a PCR test is done upon arrival. For our off-campus students living outside of our county, we're encouraging them also to take advantage of self-administered rapid antigen tests, which we're mailing out to them if they ask for it, and then take advantage of a PCR test soon after arriving to San Diego. If those students who are off campus are in San Diego County, we're recommending that they have a PCR test 24 to 48 hours before returning to campus. And of course, if they have any symptoms, they should take advantage of the testing. Reminding everybody about the vending machines, they are working very well. If you've never had a test in our system, whether it's a drive-up test with the health system or at the Price Center, we generally encourage you to have your first test there, because every once in a while our IS systems will miss you if you start off right away with a vending machine test. Once you've had that though, take advantage of the vending machine test. You need to download the UCSD app on your phone. You need to make sure you capture the barcode on the vial, testing vial. If that barcode is not captured, we have no way of knowing the test belongs to you. And we've recently seen an uptick of unidentifiable sample. So please make sure you've captured the barcode. That way we know it's your test. Your test results should be back in 24 to 36 hours. If you don't see a result, then retest. Otherwise, don't keep retesting. The result will show up usually within 24 hours. We also want to remind folks, please do not take a test and use it for other individuals. We occasionally see folks giving their test, applying it to someone else in their family as a way to get a test. That's actually considered medical fraud, and it creates quite a bit of problems. So if you are testing, only test yourself. So take advantage of the system. It works really well. All right, I think we're going to be ready to move on, and thank you. And I'll try and answer some questions in the chat.
Thank you, Dr. Schooley, Martin, and Sosha. Next, we'll hear from Director of Housing Services, Jana Severson, for an update on campus housing. Director Severson.
Thank you and good afternoon. I'm happy to be here today to share a brief update with you regarding housing and dining on campus. In response to the campus notice that was sent yesterday regarding extending remote instruction, we sent a separate communication out early this morning, encouraging our students to continue to coordinate with their roommates on a staggered return to campus, as well as encouraging them to arrive, if they have the flexibility, closer to the end of the month and or midweek, which helps with resources on campus. We do currently have students living on campus, and for anyone who needs to be here or wants to be here, that is okay. It is not a restriction to when they can arrive. We're just strongly encouraging everyone to spread out as much as possible and to coordinate with their roommates about not all arriving on the same day. As Angela mentioned, as part of that process in preparing to return to campus, rapid tests will be required, and a process for students who do not have currently access to one, a process has been put into place where they can reach out and indicate their need. And we are already in the process of sending via mail rapid tests to students so that they can complete those prior to their arrival on campus. Once they do arrive on campus, as was noted, a PCR test is required. And that for the majority of our students who are returning is going to be taking place via the vending machine testing and tables that'll be set up at these locations. We do have a handful of new students for winter quarter, and those students will actually do their initial testing at the Price Center before they are incorporated into the vending machine process. So the check-in process, which will be required, is going to be at the vending sites in our undergraduate residential communities. And we have a wonderful partnership with the student Triton Health Ambassadors, who will be staffing those tables at the vending machines starting tomorrow morning through the end of the month. And they will be there to help students check in, to confirm that they take their PCR test. They'll be providing them with a KN95 mask and also making a note of what time they are returning back to campus, date and time, so that we have that information for how many students are here. In our graduate and family housing communities, we remain open throughout the year without significant operational changes currently. Some minor things, typically around amenities in our communities. For example, our mini gyms are currently closed, and that's consistent with operations on campus as well. But we track those closely, and as soon as we're able to reopen amenities with appropriate guidance, we will go ahead and take care of those things. In advance of the students coming back, we have secured additional isolation beds off campus and are feeling very confident about the position we're in, being able to accommodate any students that return who are positive so that we can provide them care until they can move into their regular space on campus. And from our dining team, we are currently operating in a to-go only model. We have the Triton to-go app that folks can use to place orders online and then pick up in our facilities from a to-go opportunity. We did indicate originally that it would be for the first 2 weeks of January, but with the current extension, we're going to go ahead and just release that current end date. And then as soon as we know and have guidance that we can reopen as we were towards the end of fall quarter, we will be going ahead and proceeding with reopening. That's it from me. Thank you.
Thank you, Director Severson. Now I would like to turn it over to EVC Elizabeth Simmons and Senate Chair Tara Javidi to talk about the recent winter instruction updates. And first, I turn to you, Elizabeth.
Thanks very much, Bob. I just wanted to thank everybody, all the participants, for being here to learn the latest information, to hear how decisions are being made, and to contribute your important questions to the conversation. We really appreciate everything that you are doing to maintain research continuity and educational continuity for the university, despite the ever-evolving, rapidly evolving pandemic. And we know that there's a huge amount that you have to get done every day in your professional and your personal lives. So we are trying to make sure that you have clear guidelines as far in advance as possible so that you can make plans. And to that end, the administration and the Senate have been working very closely together. And so it's my pleasure to ask Senate Chair Tara Javidi to speak to the information before us. Tara?
Thank you, Elizabeth. Hello, everyone. My goal today here is to provide just a quick context for the Academic Senate's position and decisions, as EVC Simmons mentioned. In particular, EPC Educational Policy Committee's January 6th decision, which by now I hope you have read about in my joint memo with EVC Simmons today. Before I discuss, though, this decision, I would like to acknowledge that many of you have reached out to me in my role as the Senate Chair and asked me how involved we have been with the administration's decision regarding winter instructional modality. Unfortunately, today I don't have time to go through the timeline of the many meetings we have had. I just would like to really publicly and sincerely thank the Educational Policy Committee, especially the chair, Padmini Rangamani, who has been incredibly up to date and relentless to stay on top of the data, despite being scheduled to teach 2 large classes, which is the reason I'm presenting today instead of her. So I want to emphasize that the difficulty for the Academic Senate and EPC this year has been to hear the diversity of conditions and preferences, opinions, and needs of faculty and students and formulate a campus-wide decision. In this, we have tried to follow 4 principles. We have emphasized the data and the expertise that were provided very kindly by Chip and Natasha, and in fact, the entire RTL team. We have tried to stay true to this dominant sentiment amongst faculty and students to be back and teach and engage and assess the students in person, but at the same time think about the diverse ways many faculty have been affected and need support, and on top of that, do all of this in rather short span of time. So the most important question for today is to just repeat that after extensive discussion and considerations, the Educational Policy yesterday voted to grant, the Educational Policy Committee voted yesterday to grant an emergency blanket exception to the policy on distance education for winter 2022. And I'm here to sort of dissect what this really means. This means that we recognize that the almost impossible act of balancing the enthusiasm and the need for the instructors to be back in person teaching against the potential negative impacts of mid-quarter changes and shifts after the January 31st. So we also strongly believe that the instructors are really best positioned to make these hard decisions and carry out the educational mission. A blanket state exception for the remainder of the quarter allows the instructors to plan ahead for the remainder of the quarter. For example, for those that find that a mixed modality of remote and in-person teaching, or in fact fully remote teaching works best, they're allowed to plan accordingly, and no additional approval from the Senate or the administrations are required. We recommend, of course, in all of that, that you consult early and often with your department chairs to support consistent planning and to be responsive to student needs. I want to emphasize that Senate decisions fall and winter have been focused on how to ensure educational continuity and inclusive practices rather than instructional modality alone. Our hope is that the departments and instructors would do the same. It's important to communicate early and often about course instruction and assessments, and especially for the departments to consider contingency plans for addressing situations where students or even instructors may miss a class session due to COVID situation. So bottom line, the goal as far as the Academic Senate and EPC are concerned is flexibility, providing flexibility of support for the instructors in this very new challenging phase of the pandemic. Thank you, and back to you.
Thank you, EVC Simmons and Chair Javidi, for that update. Next, we will hear from Terry Winbush, Senior Director of Labor Relations and Employee Relations, with a return to campus update.
Thank you, Bob. Hi, everyone. So there's been such rich information shared, and what we wanted to focus on is the workplace flexibility as we deal with these evolving changes. So the key is that we want there to be maximum flexibility for all of our employees, staff, faculty, researchers, et cetera, our student employees as well, to allow them to have flexibility to be more remote than even whatever their agreed upon work arrangements are. And so I'll say that a different way. Let's say that they've already signed a hybrid work agreement, and they normally would come on site 2 days per week, but their work could be done operationally, feasibly, completely remote. If that's the case, then we want you to encourage them to work remotely during this month until we all return on January 31st. We want the supervisors to encourage it, right? But we don't want anyone to be required. So if someone's preference is to actually work on site, they can work on site. We've not closed the campus, that's not the case. But if they can work remotely and they want to work remotely and operationally that works for the organization, then please encourage them to work remotely. If the work can only be performed in person, then that work needs to continue, because again, the campus is not closed. We just want to limit the amount of personnel on the campus during this time. And in all of this, I just want to take everybody back to, a year and a half ago when we first started talking about some of this return to campus planning. Please remember those foundational principles of equity, safety, and innovation. This is who we are. This is what we do. We've done it well. Let's continue to do so and to be safe. Next slide. So as Angela mentioned in her presentation, employees who need to be on site, so the ones who've been on site already post the curtailment, who have been on site likely throughout the entirety of this pandemic, whatever their first day back on site was, they are required to test. And for those of us who will be returning after today or on January 31st or later, you will be required to test on your first day on site. You can use a rapid test before you come on site or as soon as you are on site, but you also still need to follow that up with a PCR test through the vending machine, the price center, or the drive-up locations, with the caveat, which is in this next section as well, that if you've had a PCR positive test, you do not need to then do another PCR test. That's the drive up, that's the price center, that's the vending machine. You do not need to do that unless you've been specifically told to by a healthcare provider. The new asymptomatic testing requirements. So this is for everyone, even if you have no symptoms, if you are unboosted, meaning whether you're eligible for being boosted or not, but you have not had your booster, you will need to test twice weekly, unless, again, as I say above, you've had a PCR positive test in the previous 90 days. So that's every 3 to 5 days. Work that out with your supervisor and your HR contact on what makes the most sense, depending on whatever your hybrid or whatever work arrangements are, to make sure that it works along with the testing policy. If you have had your booster, you may, and you're encouraged to still test weekly. Start testing for your pod again. We have wonderful access to testing that, again, a lot of employers do not provide. And so we have that benefit, and you can avail yourself of that. In-person meetings should be limited to the greatest extent possible for all of the reasons that have been shared earlier in this presentation. If an in-person meeting is necessary, a Zoom option is required. And remember, the masking requirement is still in place. No eating or drinking is allowed in meetings. So keep those precautions in mind, follow what we have put in place, and we can get back to hopefully a better outlook and outcome come January 31st, when these numbers start to come down. So with that, I'll turn it back over to you, Bob.
Thank you, Senior Director Winbush. Now I'd like to welcome our final presenter today, Vice Chancellor for Student Affairs, Alison Saderland, to give us some updates on the student experience in the winter quarter. VC Saderland.
Oh, thank you so much, Bob, and thanks for having me join this town hall today. I want to just call attention to the deep gratitude that I have for our faculty and our instructors who continue to be so incredibly student-centered during this phase of the pandemic. So special thanks to all of you. And I also wanted to bring forward for our time together a slide that provides a summary of the resources that are available for our students as they transition to a remote winter 2022 quarter. And you'll note on this slide that this list of resources is dynamic, and I would encourage you to actually visit our website, because it's where we're keeping all of our partner and campus resources for out of the classroom student experience up to date. But in brief, I just wanted to share that we have Zoom spaces on campus available for reservation in the Price Center. We have study rooms and computer lab spaces that are available. Some of these are private and others are not, but they all have access to high-speed internet for students, and they're all available by reservation. We also have outdoor study spaces, and we have an interactive map on our website that identifies those spaces for students. And of course, our students' favorite space on campus to study, Geisel, is also open. In addition, we have a virtual student union that we created in March 2020 that serves as a one-stop shop for fun and engaging remote student activities and events, and wanted to call that out as well as a place for students to stay engaged during this particular time. All of our student retention and success resources also have Zoom and one-on-one appointments available to students during this particular time. We have our professional success coaching appointments, and our virtual student veterans resource center is available, as well as our transfer student services website. And of course, OASIS has a number of flexible options for students to connect with their resources. And the team at the Undergraduate Research Hub also continues to do very creative work in the undergraduate research space and partners with many of you on campus. I wanted to share that we do have, we brought Three's Company back. For those of you that remember that effort as a way for students outside wearing masks and observing some physical distancing to connect with one another. Of course, we have a multitude of resources in the student health and well-being space. Many of you have referred students in your courses and in your labs to counseling and psychological services, an important member of our team in ensuring student health and well-being. Telemedicine is an important resource available through the Student Health and Wellbeing Cluster and CAPS, which allows us to serve students wherever they are across the country in multiple time zones. And of course, our Deans of Student Affairs and our deans in the School of Medicine and the Graduate Division are also available to provide services to students. We have activities for outdoor physical health and well-being. through recreation. And for our students who may not be right now in locations with weather as beautiful as San Diego, our virtual playground at recreation is available on the website as well to keep people active and healthy. And I'll just close with the summary that all of the undergraduate colleges have also developed programming for the winter quarter. And we have a great podcast series, Triton Tools and Tidbits, that is really about revisiting the resilience that our students hold in their hearts, that they can continue to tap into in order to move through this next phase of the pandemic. We also have our Tech Lending Hub and a number of multiple resources available. So I encourage you please to take a look at our website and know that all of us in Student Affairs and Student Services are here to partner with you at this particular time in supporting the remote student experience. Thank you so much, Bob. I'll turn it back over to you.
Thank you, Vice Chancellor Saderland, and all of our presenters today. I also have a couple of quick announcements from Academic Affairs. First, as Vice Chancellor Saderland noted, we want to remind everyone that the Geisel Library will remain open. We're dropping a link into the chat for more information. And second, any instructor who wants or needs a large or webinar Zoom license can visit the link below to request a license in the chat. Now it is time to turn to the question and answer segment of this town hall. At this time, I would like to ask the panelists to turn on their videos. As before, during registration, attendees had an opportunity to submit questions for the panelists to answer. We have selected some of the most popular questions for the panel today. If you have a question now, please use the Q&A window, as I know you've been doing during this webinar, to submit additional questions during the session, and our panelists will do their best to provide answers. Due to time limitations, we may not be able to get to all of your questions, but we'll do our best to post the answers in the FAQ at returntolearn.ucsd.edu. So I'm going to go to the first question then, and that is a multi-part question that can be addressed by Dr. Schooley and Martin. And the multi-part question is, what percentage of current UC San Diego infections are Omicron? Is there a projected peak date for Omicron, and are there new variants of concern that infectious disease experts are already watching?
The third question first, there was a little blip of a new variant seen in southern France over the last several weeks, but so far it hasn't broken out and people don't think it's going to. We're going to see this happen over time. This virus evolves, but right now there's not a particular one that has us as focused as Omicron has. If you look in the hospital, there's still quite a few Delta patients in the hospital. This reflects people who've been in the hospital for a while, and also people from populations in the county who haven't been vaccinated very well. We do have some people in the hospital who have Omicron, who have been mainly those who have not been vaccinated. On the campus, we think the vast majority is Omicron. We have a very highly vaccinated population, and that does a pretty good job of clearing out most Delta. The characteristics of the cases among students and staff are Omicronish, in the sense they don't seem to be that severe. So I think if you talk about the campus, almost all Omicron. If you talk about the hospital, still some Delta hangover. And Natasha, do you want to talk about the third question in the cluster?
Sure. In terms of the projected peak date, our best estimates for San Diego are that we will possibly reach the peak, as you saw in the data that I showed you today, in the next week or so. That's fairly consistent with national modeling estimates showing an anticipated peak about the second week or mid-January in the United States. And also fairly consistent with what we've seen in other settings. Chip showed some data from South Africa, which indicated, that from the beginning of the peak to the tail end of the surge in, for example, the earliest place in the Guangdong province where they first identified Omicron in South Africa was about a month's time. So I think, the take-home point is that you can see the steepness of the curve in terms of the acceleration of cases that we've seen. The steeper the rise, hopefully the faster the fall, so that we anticipate this is an intense surge. We will see a rapid rise in cases, but hopefully we will quickly get to the peak and then be on the other side of it by the end of January.
Thank you. The next question is back to you, Dr. Schooley. What, if any, changes have there been in terms of the understanding of transmissibility regarding airborne versus surfaces with the Omicron variant?
Omicron is extremely good at airborne spread. That's why it's just been exploding around the globe. And there seem to be quite a few so-called super spreader events because there are some people who are just highly infectious. There's no real evidence that it's a particular concern from the standpoint of surface spread. Over the last year and a half, there's been more and more evidence that surface spread was something we worried too much about throughout the whole epidemic. And in some ways, all the washing and wiping and fogging was a distraction from what we really needed to be doing, which is getting vaccinated and wearing masks. I'm not saying don't wash your hands and all that, but don't do that thinking that that's an equal problem here. It's really primarily airborne.
So high quality face masks are very important.
Absolutely.
Thank you. The next question is for EVC Simmons. Is there a chance that classes may continue to be remote after January 31st?
So is there a chance? I think as we've seen in this pandemic, I can't honestly say that there is zero chance. What I can say is that you have seen the same evidence that I have seen from Dr. Schooley, from Dr. Martin, and to the best of our ability, knowing about the variants that now exist, we believe that projecting a return to in-person teaching on January 31st should be accurate, should be possible. If the situation changes, we will keep you fully informed as quickly as possible. That's what I can honestly say at this moment.
Thank you. And to follow up about mode of instruction, should faculty offer hybrid or asynchronous options so that students do not feel compelled to come to class sick?
So, that's a great question, and I'm glad that it was asked, because we certainly want students who are sick to not come to the classroom. We want them to take care of their health, be isolated, be in isolation housing if that's what they need to be. The Senate and administration do ask that instructors please use the resilient teaching methods that the Teaching and Learning Commons has put together and put out information on. We do encourage instructors to please give flexibility and support to students if a student's going to be ill for a few days, so the student knows that they still have a way to complete the course. But this is not the same as saying that an instructor must teach every element of a course in full hybrid modality, right? Offering flexibility to the way that the instructor does that within the context of their particular course is going to be very different from class to class. And so we don't want to say you have to do it in one particular way. Thanks.
Thank you. Question for Dr. Schooley. Are there any timeline updates on vaccine approval for children under 5? When will boosters for 12 to 15-year-old children be rolled out now that they have been approved by the CDC?
The 12 to 15-year-old booster should be available now, both in commercial pharmacies and other, also UCSD Health. So those are for people who've been vaccinated 5 months or so earlier with the Pfizer vaccine. I believe it's still 6 months with Moderna, is it not, Angela? And what's being offered is the Pfizer vaccine. The 2 to 5-year-old vaccination availability, we hope was going to be about now. But what happened was when they gave, when Pfizer tried the 2 doses they started with, they aimed low and they ended up with not as much of an antibody response as they'd hoped they'd get with 2 immunizations. They had to go back to the drawing board and change the dose and schedule, and are seeking to get higher levels of antibodies before they release this. I think it's hard to predict with certainty. The fact they had to turn it around in November and kind of pull back on it makes me think it won't be any sooner than March or April. But if they decide they need to give 3 doses, it could push it back a little bit further. So we're watching very carefully. It was a bit of a disappointment, but that's why the studies are done, to really make sure the right dose is used.
Right, thank you. Next question is for Dr. Sosha. When we return to in-person instruction, will testing be required for vaccinated individuals to reduce asymptomatic spread?
Thanks for that question. I think we have to go back to that careful language of what is considered full vaccination. So right now, if you are eligible for your booster and not boosted, you're not considered fully vaccinated. And you're like the unvaccinated individuals. And during winter quarter right now, it's twice a week testing if you're on campus. So even though some folks are remote, if you are coming onto campus, it's twice a week. When we become all in person, then it becomes twice a week. If you are boosted or fully vaccinated, not booster yet eligible, then it's a weekly recommendation, but not a requirement. Hope that helps clarify that.
Thank you. Next question for EVC Simmons, again about mode of instruction. How will we continue teaching lab classes during this period of remote teaching?
Yes, those are some of the most challenging situations. And this is a situation where I think that it's important for the instructors to talk with their colleagues who have taught those same lab classes remote during the previous 5 quarters of the pandemic, because we do have experience with teaching. Unfortunately, we now have experience teaching all of our courses remote, including lab classes. So talk to those who have previously taught that class remote, stay in contact with the department chair. We need to get through a few weeks of remote together to keep the campus safe. And I know it's really, really hard, and this is not anything that any of us wanted to have to do. 93% of our courses were scheduled to be in person for winter. We were all really looking forward to that. So we'll get back there. That's kind of what I can offer. I think colleagues will be a great source of support on this.
Thank you. The next question is for Deans Anthony and Moore. How are we accommodating international students who are unable to return?
I can start with that, and I would harken back to EVC Simmons's remarks about flexibility. It's possible that for some classes, international students could attend a class remotely, even if the class were to return to be in person, through things like podcasting and some accommodations around assessments. On the other hand, that's going to vary from instructor to instructor based on the way the instructor has the class set up. And so in some classes, it may not be possible to do that. And again, this is something that we have to leave up to the faculty to determine. Again, encouraging people to take part of the, make use of the Teaching and Learning Commons resilient teaching suggestions, and also to show flexibility. The international students should also be in contact with their academic advisors, with their college advisors, because if it turns out that some of the classes are not able to be completed fully remotely, then they should look to see what other options might be available for them, and also to be involved with Dulce Dorado's office on the international IPSO, the International Program Student Program Office.
Thanks, Dean Moore. As far as the graduate and professional student side of this question, thankfully, we are not getting any sort of substantial reports from graduate or professional students who are unable to return back into the country. Part of this, of course, has to do, as we all know, with the fact that most graduate and professional students we're talking about international graduate and professional students, don't actually leave for the short period of time that is the winter break. So a lot of them just frankly stayed in town. But regardless, we're monitoring this closely, and we will deal with things on a case-by-case basis with graduate coordinators and graduate programs.
Thank you. I think we're down to around the last questions here, and they're both for Dr. Sosha. The first one is, Do the UC San Diego drive-through testing sites have the capacity to offer testing for the community in addition to UC San Diego patients, faculty, staff, and students? So let's address that first.
I think the first thing is the vending machine drive-through process is really only set up for campus and health system and employees and students. The drive-through is more for the community. And there's been less access to at-will testing in these sites, which has made the health system under some state requirements. You can't just offer a test at will. So that's been just a challenge out of our hands.
And the final question, a lot of folks are asking about how to use rapid tests in the question and answer window.
Sure.
Did you speak to rapid test use?
Yeah, and I think this is important. So I think there is a unique phase that we're using in the pre-diagnosis. I don't know if I have an infection. And we're using it for the individuals outside of our San Diego area. So our undergrads who are coming onto campus, whether on or off, to determine if they have an infection. It is not the best test, though, for determining if you have an infection. The best test is the PCR test, which we've made rapidly available to our community within San Diego. So we're recommending that you use for a diagnostic test, a PCR test. The second use of that rapid antigen test is if you've had a diagnosis and you're in isolation, it is a reasonable test to find out if you're still shedding enough virus to be infectious and should stay in an isolation from others. That's why we're working out programs for our students in isolation to get rapid antigen tests. And we're working on a program for our employees similarly to get access to a rapid antigen test so that you can reduce your isolation period. You still have to mask for 5 days. So that use is different. That's for a post-diagnosis assessment of isolation need. So 2 different uses for the test. The PCR remains the cornerstone of our diagnostic test for most people in our San Diego community.
Thank you, Dr. Sosha. Well, I'm afraid that is all the time we have for today. We've gone over a bit. I want to thank everybody who came today for their questions. We're going to do our best to answer everyone's questions by updating the FAQ that is on the Return to Learn website and posting a recording of this town hall there as well. I'd like to take this time to thank the presenters and the guests for sharing their time and information with us today. And I thank you, the faculty and researchers of UC San Diego, for attending today, working together as a community to help bring us through these unprecedented times. We had more than 600 attendees today, and these town halls are an important part of how we stay united as a community. To help improve them, we encourage you to complete the post-event survey that you will be sent shortly to help us continue to refine our communications during this challenging period. The next Return to Learn Town Hall for faculty and research will be next Thursday, January 13th, co-hosted by EVC Simmons and our new Vice Chancellor for Research, Corinne Peak-Aza. Please visit the RTL website to register, and the link is in the chat. This concludes the Return to Learn Faculty Town Hall for today. Thank you, take care, stay safe, and I really look forward to seeing you all on campus again soon.